everybody, I'm Dr. Carine of Carine Pediatrics. I'm here for our weekly update during the COVID outbreak, and I'm going to do a little bit different today because I don't feel like there's been a lot of new news this week, but I do want to kind of highlight a couple things. There's a lot of stuff with a disease that we don't know that changes, and we get new information, and we still have a lot of questions to be answered, but there are a lot of things that are playing out to be true that were part of our original data that continue to be true. So this week, Ohio released their numbers of deaths and cases based on age, and as we see in the Ohio data, it is still almost all cases of death and serious illness in patients starting around 50, but really escalating over 70. So those numbers are still remaining true. Our high-risk populations are still mostly based on age and high-risk conditions like heart diseases and things. That hasn't changed. Our cases among children in Ohio are very good. We've had no deaths and very few hospitalizations. I think at the last count there were 30 total, but all of those children have been released home and well. We've had no cases of the inflammatory condition that has been making the news either. So we're doing well. I think one of the things I've been looking at international data that I want to point out to everyone, because all we can do is kind of look at data and make predictions and see where we're going, because time will tell us the truth. But in international data, sunny, warm, hot places are doing very well. And even in America, as you see, like New York has been very affected, where California has not been. They're both dense cities with international travelers, and very different in the way that they have played out with this disease. Some of that has been the behavior of the governors being different, but I think there's also a part of geographic area, because if you look internationally, our warm areas of the world, South America, Africa, who really don't have good healthcare systems, are still faring very well with this illness, so that's great news. And those areas that are kind of cloudy, like Ohio, UK, France, Spain, Italy, they are having the harder numbers, like New York. So we're going to talk about that in a minute on what we can do for our families. But I do think that that's very good news for the summer. We won't know for sure what will happen. I'm sure we will see more cases as we come out, like I've said all along. But I think that overall, it looks like our summer should be positive as compared to what our dark, cold months have been. So I wanted to circle back to some nutritional issues with some of the data we're seeing coming in about the illness. So early on in this disease, and if you are a patient of mine regularly, you know that I tell all of the Ohio families that they need more vitamin D. So if you've been following our regulations and dosages that we give you at the office for children, then you should just continue those unless you spend a lot of time out in midday sun, because it is a vitamin that builds over time. It stores in your fat cells. So if you've been taking your good doses that are dosed at us at your well checks for vitamin D over the last winter, then your stores should be fine and you should be ready to go about your summer days. Maybe dropping down to, if you're out a lot in the sun, you may not need any, or if you're out in the sun some, maybe taking it down to a regular 500 international units or so a day for children. But if you were not taking it this winter, which I have a feeling a lot of people weren't, if you weren't taking your vitamin D this winter, I want you to understand that at the end of winter is when our vitamin D levels really drop to the bottom. So if I draw blood levels on patients who live in Ohio who were not supplementing their D at high levels, like between 2,000 and 5,000 a day through the winter months, then their numbers are terrible. They're usually 12, 18. Drinking vitamin D milk is not enough to get that numbers up to normal in Ohio. We have a lot of cloud cover. The sunlight can't get through. We just don't maintain vitamin D levels the way that other areas of the world do. Top 10 cloudiest cities in America. And so we need a lot more D than what that RDA says. So if you have not been taking it this winter, even though it is sunny now, I'd like you to take some higher doses for the next week or two to get yourself up to dose. And then now, once we're outside, you can go back to that regular 500 to 1,000 a day from here on out. But if you're an adult and you have not been taking vitamin D this winter, I think you should probably be taking about 10,000 a day for the next week or two. If you're a child and you haven't been taking it this winter, and when I say child, I mean like kind of under 10 in this case, then I would want you to be taking like 2,000 to 5,000 a day for the next 2 weeks, and then you can drop down to that 500 or 1,000 if your kids are outside. And so that's super important. We know vitamin D is an extremely important part of our immune systems. We're still collecting data on how it interacts with COVID specifically, but we know outcomes on flu and other respiratory illnesses are affected by vitamin D. And as I look at the world map and the areas that are most affected, it's very suspicious to me that those cloudy, dark areas are the ones getting the worst hit by COVID. So this seems logical and easy and not expensive thing. So you are good to try that right now. Other things that we talked about for boosting your immune system that are still true. Zinc in good numbers, that around 10 to 30 milligrams a day before you're infected helps build up the receptors you need to fight COVID. And that's just part of good viral infection management. Good multivitamins can carry zinc depending on how much is in there, along with vitamin C and some of our other B vitamins and stuff that can help your energy stores to be good. So we do have plain zinc supplements here, but we also have good multivitamins that would combine that together, which would be a great option for you. And then as we see these new things coming in, where heart disease, cardiovascular disease, clotting disorders, even the inflammatory conditions that are being seen in children, those are post-inflammatory responses. Now, what we know about our immune system is sometimes the inflammatory system can overreact to situations. This happens even in other illnesses, not just with COVID, but it seems like this particular illness is very good at that. So we're seeing a lot of diseases in adults relating to clotting, like heart disease and strokes and clotting disorders in the lungs. And so we know that clotting is playing a big role in this illness. And then in children, we're getting a lot of these inflammatory conditions in the rare cases that occurs. We don't have a lot of information on how to prevent that. So I just want to be clear that we don't have any data that's coming through the medical community, except for once you're admitted. They are giving blood thinners once you're admitted for that condition. But when I think about inflammatory conditions as Americans, a lot of you know that I recommend omega-3 supplementation for all Americans eating a normal American diet, because we corn feed our meat and milk supply, and that makes us effectively omega-3 deficient. So that's not really a treatment for one disease, but it does worsen our inflammatory conditions in industrialized countries. So that's a really simple thing that I usually recommend on every well check and times throughout the entire year, but it will be particularly important in this time because we know omega-3 plays into that inflammatory cycle and clotting issues that we have. The other thing that I've been thinking about, but it's really more my own theory, is that we use a lot of curcumin in the office for a variety of things. Curcumin is an immune regulatory agent that helps with overactive autoimmune responses. And so if you are taking curcumin for some other reason that we've given it to you, certainly I want you to keep taking it. And that also might be something that we might consider in low doses to have in our society right now, either while we are just well and circulating, or maybe if you were to become COVID positive and you would want to prevent that delayed response, that happens 2 to 4 weeks later after a COVID infection. We could add curcumin to that response. So those are my thoughts short term, and nothing is perfect, and we don't have exactly the right answers. These are just my own theories and thoughts on how we might address this nutritionally going forward. There's lots of other things that are important, like good sleep, good bowel health, keeping a diverse diet and your bowel flora strong. That's an important part of our immune system. And keeping our mind and wellness. If you're at home, you could be doing yoga, you could be outside in the sun. These are all very important wellness parameters that we need to make sure we remember, because our immune systems do actually build or weaken based on our overall health. And so if we keep those standards of sleeping regularly, getting outside, exercising, maintaining some social relationships in whatever safe way we feel like we can, those are actually really important parts of your immune system. So make sure that we're taking care of ourselves as best we can. As always, we're here available for you for telemedicine or at purelyintegrative.com for your supplement needs. Thanks.